Welcome everybody to our weekend webinar series. This is our 6th webinar for Physician Support Lines work. Our speaker today is Dr. Michael Maslar, PsyD. He is the director and founder of Mindfulness and Behavioral Therapies program at the Northwestern University's Family Institute. He's also faculty at the Northwestern University. As part of what I like most about the program is, especially because I am a child and adolescent psychiatrist, is the multifamily dialectical DBT groups that we have. And Michael, if you don't mind, when you start, tell us a little bit about all the clinical services that we have under that. Michael, Dr. Maslar is also a co-author of the Dialectical Behavioral Therapy Skills Workbook for Bulimia. Apart from DBT, he is also trained and a trainer for Radically Open DBT, and is also utilizes acceptance and commitment therapy and other mindfulness-based therapies for his work. I hear that he has a personal practice of meditation, mindfulness, and concentrative for about 20 years now. My director / supervisor says to me that Dr. Maslar has a Zen quality to his presence that will probably come across during this presentation as well. So over to Dr. Maslar, if you want to do like a small introduction about yourself as well, and then we'll get started.
All right. So, hello, good morning, everyone, or maybe afternoon. We're kind of in that transition, right? And yeah, thanks for inviting me to do this. This is, I think of this as a tremendous privilege to be able to help out in this way, especially at this very difficult time. So let me, I'm going to get my presentation, my slides up, because Smita had asked me to talk a bit about my journey. So I thought that, that is a little bit of the presentation. So let me get that started. And I'm going to switch back and forth between my image and the presentation itself. And also I want to encourage people to ask questions along the way. I might not be able to get to all of the questions that people might have in the chat box, but I'm going to do my best as we move forward. So I'm hoping that everyone can see the slides. Smita, is that?
Yeah.
Okay,
yeah.
That's the case, great. All right.
One thing that I forgot to mention is the reason I like Dr. Maslar's program, or the way that he has set it up at the Family Institute, is all the faculty or the people who are part of it are very much invested, dedicated to it, and also not only are training others for the skills piece, but I feel like the conceptualization, the conceptual framework for DBT and ACT, it sort of gets ingrained in these people. And that is something that seems to be missing at times at places where DBT is taught more from the skills perspective. Of course, that's important, but also at times the conceptualization gets missed. And if you could like elaborate on that piece sometimes, Michael, when we get towards more philosophical meaning-making questions, that would be great.
All right. Well, certainly. And thank you for, those are really wonderful comments. And we do, in our program, we don't just kind of work with the ideas, the concepts, the practices that we try to teach our clients, our patients. We try to live those, and that's nice that it comes through. Good. Mm-hmm. So over the course of the next hour or so, I'm going to talk a bit about my journey, what I'm thinking of as being a bodhisattva scientist, the role of ACT and DBT in the work that that you are doing, that we are doing, the roles of empathy and compassion, a loving kindness practice, and radical acceptance. All right, so let's see. So next, so how I got here. just a bit of kind of talk about my journey. And so I originally became interested in meditative practice when probably I was in my late teens or early 20s. I found myself on a search for to cultivate a kind of experience that I just kind of had accidentally. And I think we all tend to have these experiences where self kind of melts away, and the kind of the distinction between the world, the universe, self and other kind of melts away, and we have an experience of oneness. And I had that during a hike that I was on with a friend, and we had just kind of climbed up a large mountainside and came out of some trees, and I looked out over the valley below and just had this sense of oneness with everything. And it might have been the exertion and the altitude that did that, but that doesn't matter because however it came to be at that moment, I had that experience, and I thought, this is really cool. And I wonder how to have this more of the time. So I entered into yoga practice and meditative practices, and that became a part of my life on and off. I certainly haven't been the most consistent practitioner, at least in the early days, but it certainly began to change my life. And then when I was working on doing my doctoral work, I learned about DBT, dialectical behavior therapy, and that mindfulness and meditative practice was an integrated part of that work. And I thought, this is really cool because I can bring together some very personal practices that helped me tremendously throughout my life and through some very difficult times. And I could use that in my work in helping others. So that got me started in learning, doing, and then becoming a trainer in dialectical behavior therapy. And along the way, I kind of collected and became invested in other approaches that integrated meditative practices into the approach to helping people, including acceptance and commitment therapy and something called radically open dialectical behavior therapy. And so that kind of brought me to where I am today, where I'm running this program at the Family Institute, and we're doing all of these therapies and working with a wide range of presenting problems. And this gives us a lot of flexibility and an effective way of working with relatively severe problems, across a range of different coping styles. And many of the people we work with are high risk, and so it's not only been important for us to figure out how and to learn approaches that will be helpful with people who are at high risk, but also approaches that help us as practitioners not just cope with that difficulty, but to also, when we can, to thrive in it. So I'm hoping that what I'm going to be talking about today is not just useful in order to help you teach to people on the helpline, but also for yourself as well. And because I find that these approaches are most effective when you can actually live that path yourself. So I just want to take a moment here to check in with some of the questions that have already come up. Okay, so, all right, so someone had a question about radically open DBT, and it was answered, and I'll talk a little bit more as we go forward. All right, so let me go back to sharing my screen. All right, so that's a bit about how I got here, where I'm at right now. So I thought, I wanted to talk about why I chose to kind of add into this presentation this piece about being a bodhisattva scientist. Now, bodhisattva in Buddhist circles is a person who can reach nirvana but delays doing so out of compassion in order to save suffering beings. And when I think about especially the frontline workers, but really all of us, we're all smart, educated, motivated people. And there's a lot that we could be doing with our lives that would be perhaps more in service of our self-interest rather than in giving to others. But instead of doing something that might be in many ways possibly more lucrative, maybe less stressful, we've chosen to help others. And we've chosen to be on the front lines in various ways. And so in this way, we're all bodhisattvas. We could be living easier lives, but we choose not to because we want to help those who are suffering. So, and what is a scientist? Okay, a person who is studying or has expert knowledge of one or more of the natural or physical sciences. And so why did I choose this? Because we are the bodhisattvas that we are. We're choosing to help others, and we are committed to doing so in ways that are evidence-based, so that we're using science to the best of our abilities to help each other. And so that brings me to ACT and DBT. So just a little bit of an overview. ACT, or acceptance and commitment therapy, is a therapy that targets experiential avoidance. And so in essence, the strategies in ACT are oriented towards helping people be in contact with their experience, because there are unintentional negative consequences when people chronically or repeatedly avoid their own experience. When they avoid their emotional experience, they avoid their thoughts, they avoid what needs to be done for themselves in life. And so acceptance and commitment therapy targets experiential avoidance and helps people lean into discomfort in order to do what is important in their lives. And then DBT, or dialectical behavior therapy, and there are now two major versions of it. Standard DBT targets emotion dysregulation and under-controlled coping. And then radically open DBT targets over-controlled coping and social signaling. So they work, standard DBT and radically open DBT work to help people with complex sets of problems at both ends of a major coping continuum, from under-controlled coping to over-controlled coping. And so that's ACT and DBT in a nutshell, or at least their major focuses. So I want to talk a little bit here, moving into ACT right now, and this will help, I think, maybe to organize everything that's going to come next. And so in just shortly, we're going to move into some actual practice, but it's helpful to have some framework to organize things. And so the primary ACT model of treatment involves helping people make contact with the present moment, with acceptance, to diffuse from their thoughts, to not become one. We'll talk more about this as we go forward. To experience self as context, in order that a person can be clear about their values and take committed action. That's the overall view of what happens in acceptance and commitment therapy. So we're going to take each one of these elements in turn and look at some practices that can be helpful to you and can useful for you to teach as you're helping people on the front lines. So moving on next to those different elements, values and committed action. Being on the front line is doing just this, okay? So this is knowing what your values are. Values of empathy, compassion, being helpful, helping those in suffering, and taking action on that. That's what people are doing. And so not going to spend a lot of time on that just yet, but there are some practices that I'm going to introduce later that I think are really crucial for our survival, and possibly for our thriving. There's also radical acceptance and contact with the present moment, which is mindfulness practice, and diffusion and self as context. Now, I'm going to move on to diffusion and self as context right now, and we'll get to the others as we go forward. So what does diffusion and self as context actually mean? Okay, so here are some very important core ideas with respect to this, that you are not your thoughts. You are not your emotions. You are the stage that these different dramas take place on. So each of us as beings, we're much more than any single thought, belief, or collection of thoughts or beliefs that we have. We're so much more than any emotion that we might be having at any particular moment in time. But it's really easy to sink into the idea that I am my thoughts about myself, my thoughts about the world, and that my thoughts are somehow kind of the absolute truth about what is going on with me and what is going on with the world. And so when we're working with diffusion and self as context, we're helping people to step back from those experiences, to step back from a kind of fusion with emotions, that I'm taken over by emotions rather than allowing emotions to happen as part of my experience. And so here, there are some practices here, and actually all of the practices that we're going to go through today address this in various ways. But I'm going to go through some specific practices right now that work specifically with diffusion and diffusion of thoughts, diffusion from emotion, and self as context. All right. So I want to invite everybody at this moment just to observe what thoughts might be happening in your mind right now. Now, when I do that, often people will find that their mind is kind of blank, which is unusual for most of us. But just because I've told you to observe your thoughts, that sometimes people's minds go blank. But just be patient. Thoughts will come. And as thoughts arise, imagine yourself placing those thoughts on a conveyor belt. Just each thought as it comes, placing it on a conveyor belt and watching it go off into the distance. Right, next, just as thoughts come up, or if there are particular thoughts that seem to be pretty common for you to be thinking, and you can do this, you can actively bring thoughts to mind, or you can play with thoughts as they occur. Speed them up. If you have thoughts like, oh, I don't know how long this pandemic is going to last, this is really awful, speed that thought up. Make it go really fast. Or slow that thought down. I don't know how long this will last. So practice slowing thoughts down. Practice next visualizing them as text. And there's different ways that you can do this. You can practice visualizing it in your thoughts in different fonts, different colors. Visualizing your thoughts as the kind of crawl that goes underneath many news programs. All right. So those are some ways of playing with thoughts and diffusing from thoughts. Changing our relationship to our thoughts is what is the core idea here. and if there are questions again, just please jump in with them. More on diffusion of self, diffusion and self as context. Now there's working with emotions. And in ACT, there's a metaphor called the tin can monster. And when we experience emotions, they can often be, especially times like this, they can be overwhelming and quite frightening. And the idea here is that we're looking at this huge monster, and it can be useful to take a look at this tin can monster and take a look at each one of the tin cans that make up that tin can monster, to take it apart. And as we look at each different part of that tin can monster, the tin can monster itself loses its scary quality. And we can begin to understand our emotions in a different way. And again, having a different relationship, a different experience of them. So just notice right now, are you feeling anything? And you might not be feeling anything in particular right now, but most of us are feeling something much of the time, even if it's kind of lower level. It's not tremendously intense. So because I'm doing this presentation, I've got a little bit of anxiety, and so I'm noticing that. And so we can practice noticing where in the body you feel that emotion. So if you're feeling something right now, notice where it happens in your body. Is it in your head, your neck, your shoulders, your chest, your belly, elsewhere? Excuse me. Is there a shape to that experience? So I've got this oval shape of anxiety in my chest right now. Is there a texture to that experience? Is it rough? Is it smooth? So this is kind of rough. The experience for me of anxiety right now is kind of rough. Is there movement? It's vibrating a little bit. Maybe even undulating at times. And also with movement, is it changing? And this kind of rises and falls a little bit over and over again. Is there a color to it? This is, some people can actually identify this. Some people have difficulty with that. It doesn't matter if there are any of these aspects of emotion that don't make sense to the person, that's fine. Color of my anxiousness right now is maybe kind of a bluish whiteness. But just observe these different qualities in what you're feeling. All right. So any questions? Because I'm going to move on to another major section at this point, and this is a good stopping point or pausing point. If people do have some questions about anything that we've talked about so far, feel free to add anything to the chat.
I see one question there, Michael.
Okay. That's actually, it's for some reason during the share, it's not showing up the way it usually does for me.
I'll read it.
Oh, here we go. There we go. Got it. Thank you. Okay, so when I slow and speed my thoughts, they become stuck, or I may forget the thought, like the thoughts in different fonts exercise. And just notice that any of that happens. Okay, so the whole point is to have a different approach to our thoughts, and you may find that they do unexpected things, which is just fine, just fine. And let's see. All right. I think that was it. And then I see your note to everyone, Smita. All right. Oh, here we go. Would an exercise around witnessing and playing with thoughts still be helpful in someone who is struggling with detachment from their thoughts? Well, and absolutely yes, because we're, again, the idea is that we're changing our relationship to our thoughts. So typically, we're thoughts, we have this experience, or many of us do, that thoughts are happening to us. And in some way, especially if they're problematic, that they're kind of inflicted on us. And the idea here is that we're actively changing the way that we approach experiencing those thoughts. And that's the whole core notion of ACT, which is working on experiential avoidance. So rather than trying to distance oneself from thoughts, and this is actually a way of distancing, all right, but it's we often confuse distancing with trying to get rid of thoughts, and when we have problematic thoughts, we often try to get rid of them, even if we're not aware of that struggle that we get into. And so when we approach this practice, when we use this practice, we're engaging with our thoughts in new and different ways than we typically do. And it's all about changing that relationship to our thoughts. Now, would an exercise around witnessing and playing with thoughts still be helpful? Okay, that was the same question. Sorry, it looked like something new came up. All right, any further questions at this point? Okay. So let's move on. So our next major section is going to be contact with the present moment, values, and committed action. And I want to talk now about the value of compassion. And this is a really interesting topic for me, and I think really crucial to us as helpers. And looking at the difference between compassion and other kinds of experiences that are natural in situations where we're helping others, but may actually interfere and make our lives more difficult. So within Buddhist circles, there are some ideas about what is thought of as sentimental compassion, which is empathy or emotional contagion, and what is thought of as great compassion, which is, in our terminology in the West, simply thought of as compassion or something called loving kindness. And so we're going to be looking at the difference between sentimental compassion, which comprises emotional contagion and empathy, and great compassion. So sentimental compassion or empathy, this involves, in one way or another, sharing the suffering of another. So it's important to understand the difference between what can be thought of as co-suffering, first of all, versus empathy or emotional contagion and empathy. And one of the differences is a sense of agency. When we are co-suffering with another, we experienced increased activation in the insula, anterior cingulate cortex. There's a lot of, so this is a stress response. It's an unpleasant experience, and co-suffering is difficult to sustain. This is when we are kind of overcome by the suffering of another. Now, empathy is different in the sense that we have agency. We have a sense of agency. We're not taken over by the suffering of another. It allows us to understand the suffering of another, and yet it still can be unpleasant and difficult. So what then do we do here? Great compassion or loving kindness is the experience of warmth, concern, and care for the other person. And when we experience loving kindness, there's increased activation in the medial orbitofrontal cortex and the ventral striatum. And so we have, and this is kind of correlated with a greater sense of agency and a sense of regulation. We have better feelings than empathy, and this is more sustainable for us as helpers. And so this has been, along with a lot of the studies of the neuropsychology of mindfulness, this has been a topic of great interest over the last couple of decades as people have understood the effects of meditative practice. And so this is one area that I find to be tremendously helpful for us, because when experienced chronically, empathic distress most likely gives rise to negative health outcomes. On the other hand, compassionate responses are based on positive, other-oriented feelings and the activation of pro-social motivation and behavior. Given the potentially detrimental effects of empathic distress, the finding of existing plasticity of adaptive social emotions is encouraging, especially as compassion training not only promotes pro-social behavior, but also augments positive affect and resilience, which in turn fosters better coping with stressful situations. This opens up many opportunities for the targeted development of adaptive social emotions and motivation, which can be particularly beneficial for persons working in helping professions or in stressful environments in general. And so Tanya Singer is one of the neuroscientists involved in studying these kinds of reactions. And here are some references. You'll be getting a copy of this presentation, and so you'll have these for yourself as we go forward. So what do we do with this information? Some other researchers in this area, the area of compassion and empathy, we can't feel compassion without first feeling emotional empathy. Indeed, compassion is the extension of emotional empathy by means of cognitive processes. So we first have to feel empathy for a person and know what they are going. But then if we move to compassion, if we move to loving kindness, this then helps us not get overcome by that experience of empathy. So meditation-based training enables practitioners to move quickly from feeling the distress of others to acting with compassion to alleviate it. And this is a Buddhist practitioner and a Buddhist teacher. So let's take a look at mindfulness practice. Let me pause right now and let's see. I know that there's a way for people to kind of put their hands up, but that's complicated with a large group like this. But I'm just interested to know if there are people out there who have practice in meditation and mindfulness. Anyone want to make any comments at this point? And if there, I'll just move ahead and comment as you will as we go. So mindfulness is one form of meditative practice. And the definition that I like to work with of mindfulness is that it is awareness of the present moment with acceptance. And so those are some of the elements of that ACT model: awareness of the present moment with acceptance. So it means being present in this moment. This is when our lives are happening right now. So we have, okay, just pausing for a moment. Yeah, we have someone here who took an MBSR course 4 years ago. So mindfulness-based stress reduction and still practice regularly, immensely helpful for managing my levels of distress. Thanks for the comment. And yeah, so MBSR, for those of you who are not aware of that approach, it's was originally developed to help people with chronic pain and has really good outcomes for that. And it's been extended and is one of the mindfulness-based therapies that started this current revolution in our understanding of meditative practice and how it can be helpful. So why practice? So because mindfulness has been in the media so much over the last few decades, I'm not going to go through the numerous mental and physical and mental health benefits, but in short, just to know that there are many, many benefits that have been identified health-wise. It helps to reduce anxiety, helps to reduce depression, improves immune response. So mentally and emotionally, it helps decrease negative emotions, just lots and lots of different, and it's not a panacea. I do need to say that as well. So mindfulness practice and meditative practices in general are like exercise. And when we exercise, it's not going to cure major illnesses necessarily, and maybe perhaps some in some limited cases. But exercise will help make most things a little bit easier and a little bit better for us. And this is the same with mental exercises like mindfulness. So again, these mindfulness meditations are not panaceas, but they can help make many things easier for us as we go forward. So let's take a look at what...
There's a question there.
Okay, thank you, Smita. All right. I feel like mindfulness being in the media has made it harder for those who are skeptical of this for them. Any tips on approaching in these cases? Well, I do, depending on who the individual is, you know, I kind of point to just there's really extensive research on the benefits of meditative practice, and it has been quite I guess perhaps overly sold as an approach with so many benefits. But it's just kind of maybe perhaps kind of selling it or talking to the person in the way that I have presented it here, that, you know, it's like any other kind of regimen that we might engage in to take care of our health, like brushing our teeth, like exercise. Again, it can make things easier for us, but it's not a panacea. So we have a question here. I've been practicing TM, Transcendental Meditation. I've been using mindfulness in my practice for some years. Benefits are major and have been very helpful to our patients. However, it's very challenging to guide patients and practice mindfulness if we have narcissistic traits. So if the person has narcissistic traits, I think that's the question here. And so that would be a difficult question for me to answer, because I would want to know in more detail what you're experiencing in the way of narcissism. And that would involve some interchange, which is kind of difficult, unfortunately, with this kind of chat. So I don't think that in a general sense I can offer much of anything helpful. I would need to know much more about your individual experience. So I do apologize for that. And unfortunately, there's someone else who's commenting on having a person who is narcissistic. And perhaps if we have some time at the end of the presentation, we can spend some more time with that question, and we'll see what we can do. So sorry about that. So mindfulness. Let's take a look at some of the elements of mindfulness practice. There's body posture. And so you don't have to tie yourself in a pretzel, sit in a lotus position to do mindfulness, but it is important to adopt a posture that is conducive to relaxed alertness. So sitting upright usually, although you can practice lying down, but the danger is that you'll fall asleep. And that's not mindfulness, because that's not being aware. There is focus, where you place your attention. There's the duration of your practice. There is the process, whether it's guided by a meditation teacher or using a smartphone app. And there are lots of apps out there that are useful. So, and I don't have any financial interest in any of them, so I'll just recommend some that are fairly popular, that are good. Headspace is one, 10% Happier is another. And then there is silent practice where you don't have a guide. And there's also, it's important to have some degree of consistency in practicing. So specific practices involve awareness of breath, counting breaths, a body scan, and there are more, but these are just a few of the more common specific mindfulness practices. And I just want to invite everyone into a practice right now. So, and before we get started with that, we have another comment. Headspace is currently free for all physicians. Very nice. Okay, thanks for that that information. I was unaware of that. Wonderful. So it's free for physicians during this period. Okay. So I want to encourage everybody to get into a posture that's conducive to relaxed alertness. So sitting upright. You can close your eyes, or you can leave your eyes open. I tend to want to leave my eyes open because it helps me to bring my practice into everyday life, because I'm walking around with my eyes open. But sometimes closing your eyes can help. So I will do a guided practice with you. So start by bringing your attention to the sounds that you hear. They may be external sounds. They may be internal sounds. There may be a certain quality of silence. So the experience of hearing as an important aspect of mindfulness, in that you don't have to do anything special. The object of sound arises and we hear. Next, bring your attention to the feeling of the breath. Find that spot in your body where you feel your breath most distinctly. It might be the feeling of the air as it enters and leaves your nostrils, the feeling of the air at the back of the throat, the rising and falling of your shoulders, your chest, or your belly. But notice that place in the body where you feel your breath most distinctly, and allow your attention to rest in that spot. Now notice if your attention wanders. And this is just completely natural. It may have wandered many times at this point already. This is just simply what our minds do. When you notice your attention has wandered, just simply and gently bring your attention back to that feeling of the breath. Notice what it feels like to breathe. What does it really feel like to breathe in? What does it really feel like to breathe out? And notice that you don't have to do anything special with your breath. You don't have to make your breath especially deep or slow. See if you can allow your breath simply to breathe all by itself. The practice here is one of acceptance, of simply allowing things to happen. Just allowing your breath to happen. All the while noticing when attention wanders, gently bringing it back. And it's this act of noticing when attention wanders and bringing it back that's fundamental to the practice of mindfulness. Each time our attention wanders, we remember that we are here, working on being present, and we bring our attention back. Now bring your attention back, bring the center of your attention back to the sounds that you hear. And as we bring this practice to a close, I want to invite you to take the intention of bringing this relaxed, alert awareness into the rest of our talk today and the rest of your day. All right, so thanks for going along with that practice. And if you have any comments on how that went, please share them. And we're going to be moving on. Next, looking squarely at compassion and loving kindness practice. Loving kindness practice is another form of meditation that's centuries old. And this is a practice that, as we've begun to look from a scientific standpoint, as well as from the practice standpoint, it's a preferred experience in the face of suffering. And what we've found in looking at the neuroscience of this is that loving kindness practice activates the ventral vagal branch of the parasympathetic nervous system, and it helps to counteract sympathetic threat activation, which we're highly prone to experience when we're in the face of suffering. And it increases respiratory sinus arrhythmia. And so these are signs of being more in the ventral vagal activation and a calmer activation. It increases pleasant emotions, decreases painful ones. It's been shown to increase gray matter volume. Interestingly enough, along with mindfulness practice, protects telomere length. And so it seems like it might have some effect on aging and easing the aging process. It increases the experience of compassion. it can be effective even in small doses. Even just one loving kindness practice can last for a while for a person may last, and our anecdotal evidence, and this is also there's research evidence to back this up, that it can last, one practice can last a full day for some people. And it can also have longer term impact on a person's functioning and their experience. So I'm going to invite you in a moment to go through some loving kindness practice with me. And there's various versions of this, and this is just one of them. And the idea is to, in this practice, to generate the feeling of loving kindness. And there's no special order to this, but this is one order: towards oneself, then to other people. And I want each of you to take a moment as I go through this, to figure out who you might want to focus on during this practice. And so it will involve bringing to mind an image of a person who is easy to feel loving kindness towards. So take a moment. Who would you focus on in your practice who is easy to feel loving kindness towards? Then someone who's neutral, someone a cashier you might know, a doorman, someone else who you don't know all that well, but is familiar to you. And then someone who's difficult to feel loving kindness towards. So who would you choose to be the focus of these different practices today? And then we're going to work with an image that captures all beings everywhere. Excuse me. And for some people, this is envisioning the Earth from space. And what we're going to do is direct loving kindness towards each in turn, repeating the following phrases. So once again, let me pause here before we dive into this practice. Why would you want to increase respiratory sinus arrhythmia? Well, that's actually a sign of relaxation and greater heart rate variability, which is a healthier response. Our heart rate variability actually drops when we're under stress, and that's part of the stress response. And if anyone has further ideas about that, certainly I've studied this, but I'm not an expert in the medical aspects of that, and many of you may have more information about that than I do. So I invite other people's comments as well. But so now I want to invite you into loving kindness practice. Here we go. Okay, right. So okay, so respiratory sinus arrhythmia is a phenomenon that happens with every breath. Excuse me. And let me add a bit to that. Thank you. So just to clarify. So when we breathe in, our heart rate increases. When we breathe out, it decreases. And this is a healthy shifting that goes back and forth with the sympathetic and the parasympathetic branches of the central nervous system. When we're under stress, there is a less resilient shift in those responses. And so our one sign of health and relaxation is a more robust shift back and forth between the in-breath and the out-breath. So our heart rate variability changes depending on whether we're under stress or not. And greater variability is a sign, to a certain point, of greater relaxation and health and fitness. All right, so loving kindness practice. So get into, again, a relaxed, alert posture. And do your best to generate feelings of loving kindness towards yourself. And repeat silently along with me the following phrases. May I be happy. May I be healthy. May I be free from harm. May I live with ease. Again, generating feelings of loving kindness towards oneself, repeating these phrases silently after me. May I be happy. May I be healthy. May I be free from harm. May I live with ease. Next, bringing to mind the image of a person who it is easy to feel loving kindness towards, holding that person in your awareness, that image, imagining them in as much detail as possible, and bringing those feelings of loving kindness, directing them towards that person, repeating the following phrases silently. May they be happy. May they be healthy. May they be free from harm. May they live with ease. And holding that image of that person who it's easy to feel loving kindness towards, directing those feelings of loving kindness towards them and repeating the following phrases. May they be happy. May they be healthy. May they be free from harm. May they live with ease. Next, bringing to mind the image of a person who is neutral. Imagining that person in as much detail as you can. Generating feelings of loving kindness towards that neutral person, and repeating the following phrases silently. May they be happy. May they be healthy. May they be free from harm. May they live with ease. And next, bringing to mind the image of a person who it is difficult to feel loving kindness towards. Imagining that person in as much detail as possible. Now doing our best to generate feelings of loving kindness towards this person who may be difficult. Repeating the following phrases silently. May they be happy. May they be healthy. May they be free from harm. May they live with ease. And next, bringing to mind an image that conveys for you the sense of all beings everywhere, which may be the image of the Earth from outer space, or anything else that might somehow convey that for you. And now bringing that feeling of loving kindness towards all beings that walk the land, all beings that swim in the waters, all beings that fly through the skies. Repeating the following phrases silently to yourself. May all beings everywhere be happy. May all beings everywhere be healthy. May all beings everywhere be free from harm. May all beings everywhere live with ease. And once again, generating that feeling of loving kindness towards all beings, repeating the following phrases. May all beings everywhere be happy. May all beings everywhere be healthy. May all beings everywhere be free from harm. May all beings everywhere live with ease. And ending this practice with the following wish. May there be peace. May there be peace. May there be peace. Right. So I do invite people to share their comments on that experience. And I do want to pause here just to give that a bit of time. So how did that go for you? So let's see, the first comment, I found it overall really made me more relaxed, but I found myself more sad at the may they be healthy part as I started thinking more about those affected by coronavirus. Yeah, so practices like this can bring up sadness, and that's true. Um, that can be fairly common. And it's just important to notice and to observe that sadness and allow that sadness to happen. It's a natural, understandable experience to have at this point. And for that also not to interfere with the willingness to engage in generating those feelings of loving kindness. So just notice that that happens. It's a natural experience. It's understandable under these circumstances in most any time when we practice loving kindness. And along with that, return to the practice. So it's basically a similar kind of experience to mindfulness practice, is returning over and over again to that basic experience, in this case, of loving kindness. The person that was easier to imagine is deceased. And so how do you change the script? You don't necessarily need to change the script. One can still generate feelings of loving kindness towards that person. And so recognize that there's not the right or the best collection of people to use during this practice. Just whoever might come to mind at the time is just fine, and engage in the practice anyway. And that's also a fundamental aspect of this practice, is learning how to experience that sense of loving kindness in all different contexts. And that's evident right through this practice with yourself. Some people find it difficult to generate feelings of loving kindness toward themselves. Toward that person who is easy, that's a good home base. the person who is neutral or difficult. These are more difficult situations, but it's all about generating loving kindness, no matter what, across different contexts. So this practice always brings peace of mind, thanks, yet it touches into soft, tender sadness. Absolutely. Very relaxed, very calm, and I felt a lot of empathy towards people I like and don't like. Nice. I've done this a couple of times before, and I forget how profoundly it affects me. I find more it leaves me more space, both for myself and for others, especially those that wind me up into a tighter space. I found myself thinking, I will make an effort to do it more often. Well, wonderful. Thank you for sharing all of those comments. Very nice. So let's see. Now we have some time for some general discussion. And here we are again. New message. I find the hostile expressions of the difficult person melting away. Nice. Good. So do you have general questions here? I know there was a question back a little bit about body scan meditation. We don't necessarily have time to run through one here today, but the basic notion is to bring your attention to scan either upwards through your body or downwards through your body, or alternately upwards and downwards. Bringing your attention, for example, to your feet, simply noticing sensations that you find in your feet, then your ankles, then your calves, your thighs, and so on. Just practicing awareness of different bodily sensations as you go, noticing if your attention wanders and bringing it back. And that's the basic practice for body scans. There are body scans that are in many of the mindfulness apps that we talked about, and you'll find them listed on the internet as well. Okay, so more questions here. What is the name of the meditation where you allow yourself to feel different emotions throughout your body? Now, I don't know if, let's see, Lois, if you are referring to the tin can practice that we did, noticing the location, the shape of the emotion, etc. Is that what you're referring to?
Is that called tin can?
The tin can monster metaphor, yes.
Okay. That's the name of the meditation, tin can.
Tin can monster, yes. So that's that's part of acceptance and commitment therapy, and that's one of the metaphors and the practices in that particular therapy. That's right.
Thank you.
You're welcome. Yeah, any other comments or questions?
I'm going to jump in here. The two people who had asked questions about a person who they are experiencing as being narcissistic, maybe we can open that conversation, and the two of you could unmute yourself and like go back and forth with Dr. Maslar about what that experience was.
Yeah, so what did you find was happening? What was
Thanks, Mita. What I was, and thank you, Dr. Maslar, vast and periods on this end. I was just wondering, you know, actually I'm struggling with this because I've been using, as I mentioned, mindfulness quite a bit in the setting that I used and worked for several years. But you know, when somebody has these narcissistic traits, tends to intellectualize everything. And it's extremely, they would listen, but it's very difficult for that person to even kind of get to that point of being present without constantly covering with this, as I say, intellectualization, which is very prevalent in a particular person I'm thinking of.
All right, so if there's a way that you could be that person. I'm going to do a little role play with you, okay? Just so I can understand. Is that okay?
It is. The reason I'm smiling is just because that particular person is, it's very young, and I'll try.
Okay, all right. And so I just want to get a sense for how they might respond, and then what I might do about that. All right. So, and what's this person's name?
I will just shorten it. Cause
Just the first name.
AOD, it's a male. Yeah.
Okay. We'll call him Dave. All right.
Okay.
All right. So, so David, all right. So I just want to, let's do a little bit of mindfulness practice and just bring your attention to your breath and feel what it feels like to breathe right now. All right. So David, so tell me what's happening right now.
Well, I just basically cannot stop thinking, and this feels very detached to me.
Ah, okay. Okay. Well, that's all right. So that happens for some people. Okay. So I want to just double check here though. Did you try to bring your attention to your breath? Then what happened? Did you make an attempt at least?
Yes, and as soon as I do that, then my mind starts analyzing the breath and judging it, and yeah.
Okay. Well, so first of all, I mean, that's part of the basic practice for anybody is that, we bring our attention to some physical focus, something some information that's coming in through our senses. And then, because we are so socialized to be thinking about things so much of the time, it's really easy for us to go immediately back to thinking about what's happening rather than feeling it. So let's just try, let's try a few different places. And by the way, it's not about being able to be aware of your breath, for example, and bring your attention there and just that you can just maintain that focus. We're constantly going back and forth between thinking and the focus. All right. So that's what happens for everyone. But let's try to find okay, now bring your attention to the bottoms of your feet. Can you feel your feet against the floor? Can you feel your feet inside your shoes? Can you notice that?
Yes.
Okay, good. All right. So, and what we're kind of doing here is what's called a body scan. So we're going to take care of a couple of different questions all at once. Now, just bring your attention to your legs. Can you feel the back of your legs against the chair that you're sitting
in? Yes, there comes the difficulty for me for role playing because my mindset is completely different than
Yeah,
this
yeah.
person. Yeah. But yes, yeah.
Yeah. Okay. So David, so just notice, okay, that you are able, even for a brief moment, to come in contact with what's happening, and that's where we start. All right. So don't worry that it's difficult to maintain that focus because it's difficult for everyone. We're just going to take things in just small steps here and build on that experience. It's kind of like getting a toehold and then building on that. Okay, are you okay with us doing that over time?
Yes.
All right, good. So so Vesna, that's how I might approach that situation. Does that make sense?
It does. Yeah, it's, I have to be honest, it's like a very, this is a person that even when I suggest for journaling some thoughts, I'm reading James Joyce novel. I mean, I'm not exaggerating. Amazing vocabulary, but it's just to give you an idea. Yes.
Yeah. No, absolutely. I get that.
But I can make it simple and really I can make it a little bit more simplified, and walk you through more so,
Yeah.
Thank you.
You're welcome. Good. And so there's another question here. Would you please suggest some practical methods to strengthen vagal parasympathetic tone other than mindfulness? Thanks for the great experience. Well, so loving kindness is shown that that's one of the results, one of the outcomes is that it strengthens vagal tone. I want to share with you an additional strategy, additional skill from radically open dialectical behavior therapy. And so this is a skill that activates a parasympathetic response, a ventral vagal response. It only lasts a brief period of time, but it is something that you can do over and over and over again. So let me stop the screen share for a moment. And I encourage you all to, can everyone see me at this point?
Yeah.
Yeah, okay, good. So this is called Big 3+1. and it involves 4 different behaviors. 3 you can do whether you're standing or sitting. 1 you can only do if you're sitting down. All right, so it's eyebrow wag, which is popping your eyebrows up. And if you notice, when people greet each other, this is something that we, when we know somebody, we do this naturally. We just put our eyebrows up. It not only signals friendliness, it's a response. It's a bidirectional response along with the parasympathetic activation. All right, and there's a closed mouth smile, a deep breath, and if we're sitting down, leaning back and relaxing. Now this collection of behaviors activates a parasympathetic response, a ventral vagal response. And you can do this over and over again in the course of a conversation, in the course of working with people. So let's try this. So take a deep breath, push your eyebrows up, smile, and relax, and lean back. Now, for just a few moments at least, you'll experience a ventral vagal shift. So that's another means of doing that. And this is something, again, that can be done repeatedly over the course of any interaction with a person or by yourself. Okay, so other questions? What about putting really cold water on face and holding breath? Yes, so activating activating the dive reflex. So cold water on the face, or even if you are really highly agitated, getting a large bowl of ice water, holding your breath and plunging your face into the ice water. This triggers the dive response, which is also a parasympathetic response. It may be, in some people, it's quite often a dorsal vagal response, which is really profoundly slowing down one's physiology. So that's something that can be useful in in situations where you're highly emotionally activated. Other questions?
So I was the other person who posted about a person I was thinking of with narcissistic traits.
Mm-hmm.
And my question was that in trying to introduce some of these basic exercises, he kind of goes through some of the emotions, but I think there's this reaction that's usually about how he doesn't see how paying attention to these things can help with the vastness of the current problem, and then kind of leads him to think about how no one understands the vastness of what he's going through, and everyone suggests like helpful things to feel better.
Mm-hmm. Well, that's a complicated situation, and again, so it's what I might say at any one moment in time with that person. Look at it. So it's totally up to you, and so part of it is acknowledging that some of the truth in what he's saying is that no, this is not going to this is not a panacea. It's not going to solve your problems. Okay, those you do have significant, huge problems. This is true, but this is also like exercise, where it can make a lot of things at least a bit easier. And the choice here is, are you willing to do some small things for yourself along the way that may make life a little bit easier while you're working on those bigger issues?
Thank you.
So I might introduce it, or I might take that approach with him.
Thank you.
Sure. So there's also, let's see, from Smita, another comment. I also hear gargling, singing, humming, chanting also activates dorsal vagal, and probably actually in that case a ventral vagal response, rather than a really deep shutdown response, but more relaxed response. They feel less dramatic of a quick fix, absolutely. And one thing about the 3+1 is if you take a look at people who are socializing and enjoying themselves, that's actually what people do a lot of the time anyway. So it may seem, because we're calling it a skill and we're introducing it and doing it in a strategic manner, that it may seem like it has a quality of being drama or something dramatic or being something special. And it is in one way, but it's also something that people do naturally. We're just trying to use this in an intentional way to help ourselves. I don't know if that helps. Cool. Any other comments or questions? Right. So, Smita, I don't know if we're at the end here. Is this?
Yes, we are at the end of the lecture. Sounds like because you fielded questions and as you were going along, there were less than usual. We still have, so I think at the peak of the lecture, there were 59 people. Right now, there are 43. Thank you so much, Dr. Maslar, for such a detailed and wonderful lecture. I personally really liked the part where where you highlighted that the mindfulness practices help us move from the emotional contagion or empathy place to compassion place easily, because I think a lot of us probably struggle with that. And I don't think I have heard about it in those words. I've attended other mindfulness related lectures. So that was really helpful.
Yeah, so I do. So I'm glad that you highlighted that, because I do find this to be a fundamentally important practice for helping professionals. And I would hope that in whatever training in the future as we go forward, that people in various branches of the helping professions, that this is included, because I think it's an essential skill for us.
Okay. All right, we've come to the end of our weekly webinar. Once again, thank you very much, Dr. Maslar. We are very grateful for your time and expertise and weekend time. And if people have more questions, I'll probably bug you over email.
Yeah, that's certainly, that's fine. And I will send out shortly, I'll send out a PDF copy of the presentation so people can have that.
Okay, sounds good. Thank you.
Right. Bye, everyone. Thank you for listening.
If anybody wants to unmute and say bye, that's fine.
Thank you.
Thank you.
Thank you so much.
Thank you.
Welcome.
It's wonderful.
Thank you.
Thanks.
Bye.
Very helpful. Thank you.
Bye.
Thank you.
Thank you so much.
Thanks a lot.
Bye-bye, everyone.
Bye.
Mona, do you want to say a couple of things?
Yeah. Hi, Dr. Maslar. Thank you so much. I'm the founder and chief organizer for Physician Support Line. I really appreciate everything that you did for us today and taking time out to do this very incredibly relevant lecture for not only our volunteers, but for our callers. It's so appreciated, and we appreciate all of it. Thank you.
You're welcome. You're welcome.
Hello, this is Allison Cotton. I had to call in from home today, but I'm one of the co-founders, and I just wanted to say thank you as well.
Oh, you're welcome.
This was a great start to my Saturday morning. I have to say it was wonderful going through those meditations.
Good, good. All right. So.
All right. Okay.
Yeah. Thanks for the invitation, Smita.
Thank you so much, Michael. Bye-bye.
Bye, guys.